Hey guys, Dave Mason here from Yoga for DNA, and I'm here with actually my doctor, Dr. Diane Grice, and she is a naturopath, but more specifically specializing in mental health. So it's, I don't even know how to say the word right, naturopathic medicine and homeopathy. How's that?
Yeah, that's perfect. Thanks for having me. And yes, focus in on the natural and integrative approaches to treating anxiety, depression, and sleep disorders.
So there's this new thing out there called COVID, and I call it it's like this additional force field that we have to deal with, and it's affecting people in different ways. So I would suspect you're seeing it show up in your office, as I've shown up in your office. And what can people do about it? What is there to be aware of? How can we have managed concern rather than freaking out, or because it does affect everything, your mind, your physical health, your spirit.
Mhm.
It has for me. I have to really pay attention to it and be more proactive. So, what are your thoughts on that?
Well, I certainly have. I was focusing in on the natural treatments of mental and emotional concerns prior to COVID-19, but patients who I was already working with, certainly their conditions got exacerbated in many senses because of whether it be depression based on just the sense of isolation and lack of human interaction and human contact that um, would be in the pre-COVID-19 world, an opportunity to reframe and have a different perspective and have a different vantage point than maybe they aren't able to get, especially if they aren't willing to engage in a virtual kind of world, whether that be through forums or chat rooms or discussion boards, or simply joining in with different kinds of resources that are available out there. So that's one thing that I have been encouraging people to do, is to try and identify, of course, what it is that they are missing from this, whether it be a sense of connection, or whether it be their anxiety is getting flared up based on a fear of getting sick. And so we can focus in on whatever the fears are and really try to understand where they're coming from. And of course, there's obviously in this situation a lot of valid reasons to feel fearful, for instance. But there's a certain level of fear that's appropriate. And then there's a point beyond that to where it becomes symptomatic and it becomes really impactful on the person's quality of life and their ability to sleep and digest food properly and all of those things that are dependent on a well-balanced nervous system. So I have seen an uptick of people with pre-existing mental health concerns, but I've also seen people who didn't previously experience or identify, at least identify with experiencing anxiety or depression, and now they are identifying that that is present. And so that's something that, as people are alone with themselves a little bit more and not so busy with work and stuck in traffic and all of those things, that we used to be able to be distracted from ourselves a lot more. And so this world has allowed an opportunity, if you will, for people to really tap into what maybe has been there for quite some time and has needed to be addressed and is now being brought to the surface as a lack of distraction has allowed their subconscious to really bring forth what's going on.
There's an Eckhart Tolle video I just watched, and he was talking about that and what's happening. And he's like, it's all out there now. So whatever's been suppressed is, it's out in the forefront rather than be hanging around in the background.
I see it in my adult patients, but I also see it in, the first, let's see, maybe by April or May, certainly by May, I started getting more and more parents calling the office, wanting their children to be seen because they were noticing anxiety and depression patterns and things of that sort that they didn't see prior. But
Hmm.
when I talked to the teenager, or we're zooming or whatever, a couple that I've gotten to meet in person, they tell me that they have been feeling this way for quite some time, and that it was just that their parents are now able to identify that this is something that's going on. And so for so many in so many instances, this is really an opportunity for healing, where we are kind of we were kind of put under pressure, of course, in many aspects, socially, financially, um, with our communication. So many different things are just different and so quickly changed that all of this underlying disturbance or imbalance that may have been there, we all have, of course, just to varying degrees, is able to really be brought up to the surface, and we can do something about it. So we certainly all have more time to really spend addressing it.
So, what can treatment look like? I know it's going to be different for everybody.
Okay. Yeah. Well, and there's a couple of examples of simply having someone help, whether this be a practitioner, help get you connected with resources, or people who are identifying with this idea of feeling more depressed or feeling more anxious lately in these last few months, being open to the idea of alternative resources. So most of that means virtual resources. So whether that be virtual counseling, which there is a lot of opportunity for doing counseling work with providers, which in some instances has actually increased the availability of getting in with a therapist. But of course, you have to be willing to communicate and work in a virtual world. But the other alternative is simply finding connection. And so that is joining in with online groups and online forums. And there's so many different discussion based meetings that are happening where you sign up at a specific time and they're coming in to talk about a topic, and you can join into these groups, whether it be a book club, or a if you're religious, talking about a Bible study group, all these different, whatever the person's interests are, there are opportunities to find other people who share that, and you can
Or
connect
virtual
with
yoga.
virtually. Exactly, virtual yoga. And so that is one thing that I have really been trying to utilize, is get people connected with resources, and so that we can overcome that feeling of loneliness that we are feeling from a physical perspective, but getting to see faces and share ideas and have our ideas heard and converse about topics that we're passionate about, that's what a lot of people are longing for. And so they just kind of have to get over the idea of the logistics of it being a bit different. But I find that when people are willing to do that, it really helps. So finding that connection, whatever it may be, and then of course making time to reconnect with family and friends and people who already are in your life, who care about you and know you, reconnecting with them. And so often one of the delusional ideas when we are feeling most anxious and most depressed is that we're alone and that nobody's there for us. But in reality, there's many people who care about us. And so reconnecting with people who know you and love you and know your story, know your history, it's really important. And so that's another thing that I'm really encouraging people to do, whether it's through phone or ideally through video, so that you can see each other's faces. It adds an added element to it that it's just, yeah, there's so much communication that comes from the face that's beyond the words. So I think it's important for people to, once again, just getting, if it's an older person, getting apps downloaded onto phones and teaching them how to use it and things like that, that just makes it makes it tangible and makes it easy for them. And so getting them connected with family and friends, once again, it's just a matter of helping them remember that they are not alone in this time where it can feel so much like that's the truth.
And
And
I have experienced that at times. I live by myself, so I have to be more proactive about getting on the phone or that just really reaching out. So
Mhm.